Welcome to the Better Business Beat, your go-to source for insights, stories, and conversations that matter to our community. I'm your host, Mechele Mills, and each week we explore topics which impact the way we live, work, and do business here in East Texas. From smart consumer tips and local success stories to practical advice for navigating today's challenges, we are here to keep you informed, empowered, and connected. So, whether you're a consumer, business owner, or someone who loves supporting local organizations, this show is your front row seat to the people, trends, and ideas shaping our region. Today on the Better Business Beat, we are honored to welcome a true leader in public health and community wellness, my good friend George Roberts. For nearly 2 decades, George has served as the Chief Executive Officer of the Northeast Texas Public Health District, also known as NetHealth, here in Tyler, Texas. Under his leadership, NetHealth has worked tirelessly to prevent illness, protect our community, and promote healthier lives across Smith County and surrounding East Texas counties. Through WIC, immunizations and chronic disease prevention, public health emergency preparedness and lab services, and through wealth education as well. George has over 40 years of experience in healthcare administration and has played an integral role in community collaborations like Fit City Tyler and the Center for Healthy Living, initiatives which power East Texans to take control of their health. And today we're going to talk about what's happening with the flu season, community health innovations, and how neighbors can make smart, sustainable health choices as we kick off a new year. Welcome, George. Thanks for joining us.
Thank you, Mechele. Nice to be here today, and thank you for that nice introduction.
Yay. So, so we've learned a lot about you, but tell us a little more about you and about NetHealth and all of the things that you guys do here to help East Texans stay healthy.
Sure. Well, I'll tell you, first off, I'll tell you a little bit about NetHealth. Our, as you said earlier, our mission is to prevent illness, promote health, and protect our community. And our ultimate vision is optimal health for all of Northeast Texas. We have many programs and services through NetHealth that you briefly mentioned there, but our largest program is WIC. We cover the WIC program in 20 counties in East Texas. We also do public health emergency preparedness and disease surveillance in 7 counties. We have a regional laboratory that does water sample testing, milk sample testing, and STD sample testing. We do immunizations. We have the full bevy of vaccine for children immunizations, adult safety net immunizations, and also we can provide immunizations to all of our friends here in East Texas. We also have the flu shots out there, right, as well. We have a strong community wellness activity here. We have our Center for Healthy Living, which is a converted fire station located on Frankston Highway here in Tyler, where we offer blood pressure checks, breast and cervical cancer services, and other services to our community. We have vital stats. We do the birth and death records for the city of Tyler. We also do environmental health. We do the food and restaurant inspections here in the city of Tyler, as well as Smith County, as well as public swimming pools and spas. And one thing we like to say, Mechele, in public health world is that since 1900, 30 years have been added to the average lifespan of Americans. 25 of those are due to public health initiatives such as clean water, safe food, and vaccinations. So lots of things going on. We have a tremendous team that really have a real heart for service and really a heart for keeping our East Texas communities healthy and safe.
We owe you guys a huge debt of gratitude then for keeping us alive and increasing our quality of life. 30 years, that's amazing.
Yeah, 30 years, but then 25 of those 30 are public health initiatives that I mentioned, and then the other 5 are medical care advances. So, which tells us that so much of our day-to-day life is really incumbent on us as individuals, and that's what our role in public health is, to try to keep us safe and healthy.
So how big of a team do you have that has to do all that stuff?
Yeah, we have. So we have, since we have programs and services in 21 East Texas counties, we have 160 people on our staff.
Wow, that's a huge team.
It is.
You must have a great leadership
100 of those work in our WIC department. So
okay, so are they located in different areas, or is there like one main office that you guys work out of?
Well, no. So the WIC program is actually located. We're actually in 20 counties. So we have 21 clinics in 20 counties. So we have, for example, I have a WIC clinic all the way up in Clarksville, which is close to the Red River.
Yeah.
And we have WIC clinics along the Arkansas-Louisiana border there in Atlanta, Jefferson, Marshall, and Carthage. But then we have other WIC clinics. We have 3 here in Tyler. We're in Canton, we're in Athens, Gun Barrel City, Jacksonville, Sulphur Springs, Mount Pleasant, And there's some I didn't mention, Gilmer. So some I didn't mention
Yeah.
here, but we have a great presence all over East Texas. So we're seeing roughly 25 to 26,000 clients a month through our WIC program.
That's amazing, and we'll talk a little bit more about
Yeah.
WIC later. But what's top of mind for me, and probably for a lot of people right now, and you and I have, well, I didn't have the flu, but I did have some upper respiratory stuff earlier this month. So the flu season, the flu climate. So it appears to be increasing across Texas, across the nation right now.
Really across the nation right now. You're seeing our rates of flu are really going up. This is the cold and flu season. So we are knee deep in it right now. Really, it shall go until probably in early spring. I had a wise doctor tell me years ago that the peak of the flu season, he stated it was February 4th, and I think we're obviously headed that way right now. But as you mentioned, I got a little dose of it myself several weeks ago, and it's pretty bad, pretty tough this year. So what can people do right now about the flu is probably your next question is, we still encourage people to get a flu shot.
Okay.
It may not prevent you from getting the flu, but it'll keep you, if you've had the flu shot, hopefully it will keep your symptoms down. We also encourage people to stay home when they're sick. I tried to stay back when I was ill. So stay home when you're sick, and then wash your hands a lot. So much of our flu is spread by respiratory and also not really good hand washing. So wash your hands a lot, get the flu shot, and stay home when you're sick are the things that we really encourage people to do.
All the stuff we did during the pandemic,
Absolutely,
right? We
absolutely.
learned how to do that. Wash your hands for 20 seconds, sing happy birthday twice, and
yeah, and don't forget it. So we've had it's interesting. My community wellness team, Terrence Yates leads that crew for us, and he did a little story really prior to the pandemic, and actually they went into they were showing that only a third of guys and 2/3 of women wash their hands after they go to the bathroom, which is kind of like, yuck, that's
Gross.
not very pleasant. So they did a little quick study. They tested it out, and sure enough, what they observed, people going in and out of the bathroom, that's what happened. So wash your hands after you go to the bathroom, but wash your hands a lot during the day, and that'll keep that's one thing you can do to help prevent the spread of infections, or if something's maybe getting on you yourself, the way to protect yourself is wash your hands a lot.
Yeah, I mean, we touch doors. I was
Shake
thinking
hands,
we
we
shake
do-
hands. Yeah, the gas pump,
Yeah.
shopping carts. I mean, we're touching things that a lot of people have touched, and some of them probably didn't wash their hands. So it's really important. I always have it. And now, hand sanitizer. Does that really help? Or
It all helps.
Okay.
The best thing you can really do is go the old, as you were saying, wash your hands for 20 seconds, sing the happy birthday song, but
Yeah.
use hand sanitizer. Hand sanitizer is effective. Washing your hand is effective. Main thing is keep those hands clean.
Yes, awesome.
Or wash your hands like they say, like you just got jalapeno peppers on them.
Oh yes, and yeah, if you ever made the mistake of cutting jalapenos and then touching your eyes, then you'll
Understand that.
think about that. Think about that. So when should somebody get the flu shot? I usually October is when I get the flu shot. Will that carry me through the
Yes,
whole flu season?
It should carry you through, Michelle. But we tell people the best time to get it's really before the holidays. But the holidays have now passed, so it's still not too late to get a flu shot.
Yeah.
But here's the big but. It takes roughly 2 weeks for that flu shot to really take total effect for you.
Okay.
So
Okay.
So really, if you haven't had your flu shot, go get it today. And we offer those. You can get that through NetHealth. Also, your area pharmacies and your local, your primary care providers can provide that. So there's
No reason not to get
plenty
it.
of places to get the flu shot, and it doesn't hurt. It doesn't give you the flu as people think, but please get the flu shot. Wash your hands a lot and stay home when you're sick.
Absolutely. What about pneumonia? I mean, I'm at the age now where I'm getting. I think, is it the pneumonia shot?
Yeah, the pneumonia shot. You can get. You're encouraged to get that when you're 65.
Oh, I'm not there yet, but
Not that
okay.
you're much too young.
I
for
think
that.
I got a different immunization. So anyway,
The other thing that's out there right now is talking to one of my staff members.
Yeah.
Her baby got RSV. RSV. This is the RSV season as well. So we're seeing cases of RSV going up, and she said that even she and her husband got a little dose of the RSV too. So
Oh goodness.
it's really for children. It's really a tough respiratory disease. So again, be mindful of that.
Yes.
People can go to the state has a website. The Texas Respiratory Disease Surveillance System. You can see it tells you you don't see every case like you did maybe with COVID way back when, but it can tell you what the rates are maybe of COVID, of RSV, actually COVID as well as flu in the emergency room and hospitalization rates. And so you can see that.
Yeah.
So right now we're seeing a real uptick in all those.
So you mentioned COVID. How is it? Is it still a big deal? Is it? What has changed?
Sure. Well,
since the
COVID
pandemic?
is not as, what I've seen on the data right now, Michelle, is COVID is not as, virulent out there as RSV and flu, particularly flu. But COVID is still out there. And it seemed like people, perhaps maybe we gained some immunities over the last few years. But, people, it doesn't seem like people, it's not, early in COVID, people got COVID and really it killed a lot of people. It put a lot of people in the hospital.
Oh yeah.
It doesn't seem to be as virulent now. But again, COVID is still out there. Flu is still out there. Why should people, particularly people over 65, get a flu shot? Is because flu can lead to pneumonia and can lead to potentially fatalities. So
Yeah.
really be mindful of the flu at this time of year because flu does kill a lot of people every year, particularly in our senior citizen group.
I saw that there was a rise in whooping cough cases too. Could that also stem from people getting the flu, or where does that
Well, okay,
come
the
from?
flu. I mean, again, we really encourage whooping cough as pertussis, and you can prevent that through a diphtheria, tetanus, pertussis shot
Okay.
on a routine basis. So
Okay.
follow your physician's guidelines on that, but that's you should be getting that every 10 years.
Okay. Awesome. I don't.
And
think
really, the
people-
main thing on that is really
Yeah.
if you're for our listeners that maybe are our upcoming grandparents. Really, the one thing you can do to really protect your new grandbaby is to get a pertussis shot, and you don't want to spread pertussis to newborns. So, and they can't get those shots until they're several months old. So, please pay attention to pertussis and
That
whooping
is
cough.
that's a great tip, and I think people don't really think about that because every 10 years, I mean, so your doctor may or may not keep track of that. So that's something we should all be mindful of. A lot of babies being born.
That's right. We hope a lot of babies being born.
Yes. So, okay, so let's talk a little bit about chronic disease, blood pressure, community health. So Net Health recently unveiled a new public blood pressure monitoring device. Can you tell us a little bit about
So
that?
at our Center for Healthy Living, we have a gift from the American Heart Association. They gave us a blood pressure machine, basically, so people, anytime they can come in and get their blood pressure checked. So why is that so important? Michelle, there's a lot of, you're seeing a lot more research out there about hypertension is causing a lot of problems right now, particularly with seniors and also with pregnant mothers. Pregnant mothers are having issues with increasing rates of hypertension. So know what your blood pressure, know your numbers. A lot of times people don't get their blood pressure checked routinely. So it's really smart to know your numbers. And again, an easy, quick way to do it is come see us at the Center for Healthy Living. We're there 8:30 to 4:30 Monday through Friday. Come get your blood pressure checked for free.
Now, where is that located?
It's located on Frankston Highway there at Walton Road here in Tyler. So about roughly maybe a half mile from if you're going south on Frankston Highway, which is 155, or about a half mile before you get to Loop 323.
Okay. All right. Very good. And so what is normal blood pressure? What should it be?
Yeah, 120 over, I think it's 120 over 60 is the, 120 over 80, I think is the
120
normal,
over 80. Okay.
is the normal high blood
Okay.
pressure. But again, that's going
Yeah.
to kind of change with age.
Yeah.
But again, that's something you can, the top number gets a little too high, or the bottom number gets a little too low, or whatever.
Yeah.
You need to be paying attention to that and being
Yes.
be in constant communication with your primary care provider. Another way that you can get your blood pressure checked is through we encourage people to give blood through Carter Blood Care
That's a
or
great
American Red
idea.
Cross. They do
Yeah.
a blood pressure check on you. They check your iron levels. They check your cholesterol, and you can get some free checks just by going and getting your blood pressure checked.
Hey, I love win-wins. That's a great
Yeah.
way to get your blood
Yeah,
pressure
so
checked. And
so
do
Michelle,
something
go
good
this
for-
afternoon, and
Yeah.
once you're feeling maybe
Let's
a tad
go.
better, go donate. Go to Carter Blood Center and go donate some blood.
When I get my voice back.
Yeah.
So it's still kind of
make sure you're
rusty,
healthy.
kind of raspy.
Yeah, me too a little bit.
Yes. So okay, I love that idea. Everybody go give blood, get your blood pressure checked, and it's a great thing to do. Might as well do it at the beginning of the year so you kind of know, because most of us have New Year's resolutions that are health related. It's a good way to kind of have a benchmark.
Yeah, that's right. Absolutely.
You know?
Absolutely.
So we talked a little bit about WIC earlier. Tell us a little bit more about WIC and some of the new things that you're doing and all of the things that WIC does for East Texas.
So, you mentioned a little bit about my background. My background is I was in hospital administration before I got into public health. And one of the things that I really didn't appreciate is WIC. WIC started, the whole WIC program started in the 1970s. So WIC is 50 years old now. And it's a program that's set up to basically help pregnant mothers, new mothers, children up to age 5. We encourage breastfeeding. One of our big benchmarks is to try to get at least 80% of our new moms to breastfeed. So WIC is a great program out there, and we want to get again that population in. We want to get the babies in to check their iron levels, make sure that they're thriving. So we want to do those types of things, and for that, they get benefits loaded on their WIC card. And so their card basically, which allows them to get some extra fruits and vegetables, some grain products, bread products, dairy products, other types of healthy types of foods that will help not only the pregnant moms and breastfeeding moms, but also their children. So it's a wonderful program. Again, we're seeing 25 to 26,000 clients in our clinics throughout East Texas. So it's a great program. One of the things that we started really about 10 years ago is our Healthy Me, Healthy Babies Coalition, because we were seeing issues around, there were higher rates of maternal mortality and really infant mortality in East Texas. And that's quite unacceptable. And so what's causing that? So we really have, our coalition, is Healthy Me, Healthy Babies Coalition, has really worked hard to get around what's causing that and really put the word out about that, encourage mothers, pregnant moms, high blood pressure, we just talked about blood pressure checks. Yeah. Get their blood pressure checks. Get a prenatal visit. Make sure you're taking your prenatal vitamins. Make sure that if you have potential for potentially having diabetes, sometimes diabetes shows up in while women are pregnant. So get those things checked out and really we want to shine a light on that whole process. So that's our Healthy Me, Healthy Babies Coalition. We meet monthly, and if you want to get involved, go to our NetHealth website, which is mynethealth.org, and you can click on some various tabs, look for the Healthy Me, Healthy Babies Coalition, and get involved in that. So it's a great chance to see. We have roughly 50 people show up to our coalition meetings every month, and get involved. Because again, we want to shine a light on that. We want to make sure that all mothers have a chance to have a healthy pregnancy. Yes. And when they have their child is born, it's a healthy child.
We need our mamas.
Need our mamas, need our babies.
We do. So you mentioned breastfeeding and how and why that's so important. Or that it is important. Why is that so important?
Well, basically, it's, if you look at it this way, what's the best formula for the child? And it's the mother's milk. And you think God created has a wonderful plan. And the plan basically is that the mother can provides the nutrients that specified just to that baby. So that's what a wonderful way so you see the moms that can successfully breastfeed their babies. That's how much with the leg up that gives their child in life. Now, one of the things that we offer in WIC is breastfeeding peer counselors, because it sounds all normal and healthy until you have problems. And so I remember we had there was our first child breastfed wonderfully, no real issues, but the second child is a little more of a challenge, and it's very frustrating to the obviously the baby, but also to the moms. Like, what's wrong with me? Well, sure. There's just some things. There's some things that can be done to help with that situation. So that's why the breastfeeding peer counselors are so important, because we want that baby to be able to successfully breastfeed. And again, it's not always just this wonderful, happy process. It's sometimes that you need some help, and that's what our breastfeeding peer counselors are for. And we have even at a higher level, we have lactation consultants that are our breastfeeding peer counselors are women who have breastfed successfully and have gone through the process. Lactation consultants have higher levels of training, and we can help actually get our WIC clients involved with lactation consultants.
I think having that support is so important. I've known several moms who were not able to breastfeed, and the emotional stuff that happened along with that. They needed a lot of support.
Absolutely. So. I mean, you think because they're the poor moms will beat themselves up. Well, what's wrong with me? Well, sometimes you just need a little help.
Yep.
Get somebody that's gone through learn some tricks of the trade.
Yeah.
And sometimes that's one of the things that we have. We always have breastfeeding rooms in our WIC clinics where women can go in and breastfeed their babies during their WIC visit. And the breastfeeding peer counselors are there. A lot of times they will actually have our breastfeeding peer counselors. We allow our breastfeeding peer counselors to have, if their infants are under 12 months old, and they're still breastfeeding, basically, so a lot of times they can play the show and tell game. And so it's just such a neat program. It's such a real benefit that we really want to encourage our folks here in East Texas to take advantage of.
That's awesome. Thank you guys for providing that resource. So let's talk about the Center for Healthy Living. It's been a hub for health education and screenings. What measures of success do you track to know what programs are making a difference?
Yeah, sure. One of the things that we do, we operate it's our breast and cervical cancer program. Through that, we're able to meet with clients there at the Center for Healthy Living, and then refer them to resources. We work with our hospitals to pay for mammograms. We can also pay the screening mammograms. We also, if there's a problem, we can also pay for some diagnostic mammograms and ultrasound work. We also work with women for relative to cervical cancer screening. So that's been a real success program there for us. Another program we had there is we offer free Zumba at the Center for Healthy Living once a week. So that's been a fun. We have 30 to 40 folks that will show up for free Zumba. We do Zumba in the old fire base, since the Center for Healthy Living is an old fire station. So we have Zumba in the fire bay out there. We have free diabetes education classes. We have higher rates of diabetes in East Texas. We have roughly 12% of our East Texans are diabetics. And as a parent now, my son was diagnosed with type 1 diabetes when he was 20 years old. Typically, you find out about that much younger.
Wow.
But we have issues, and I thought that, I tell people, I thought I knew something about diabetes until my son came down with it, and I found out that I really didn't know much of anything. And also what a whack-a-mole disease diabetes is, because a lot of times with diabetes, you think you take step one, give some insulin, and step two, your insulin should, your blood sugar should go down. Well, sometimes it works, sometimes it doesn't. And so our classes, free diabetes education classes, are primarily for our type 2 diabetics, which is, type 1 is typically hereditary. Type 2 is something that's been brought on through some eating habits and through lack of exercise. Yeah. You can sometimes monitor that and also reduce those situations. So the diabetes education classes have been profoundly helpful for people and trying to encourage them to live healthier, potentially lose some of that weight, and hopefully maybe reduce your use of insulin that is causing the problem. So those diabetes education classes have been very successful. And then finally, the blood pressure. We want to encourage people. Again, blood pressure is quick and easy, but we want to encourage people to know what your numbers are. Know those numbers and get that blood pressure. If you have high blood pressure, we'll make sure you're seeing a primary care provider that can get you some proper medication, or maybe just knowing what your numbers are, maybe you can monitor it better. So know that blood. So come into the Center for Healthy Living and get your blood pressure checked.
Hey, that's a good campaign slogan for the Center for Healthy
Know
Living.
your numbers.
Know your numbers.
Yeah,
absolutely. It's a good time of year to do it. You should do it every year.
That's right.
Sorry, I was thinking about that, and then my brain went somewhere else. Blood pressure, WIC. I lost my train of thought. That happens when you get older. So,
you're still
I don't know.
Young spring chicken.
Thank you. Oh, diabetes. Okay, I have heard that numbers that can actually be reversed if you do watch your diet and exercise, and so go in and learn how to do that.
So type 1, you really can't. I mean, that's my son has to deal with that, and then there's so many tools now. I mean, he has a Dexcom now where he constantly knows what his blood sugar is. He also has an insulin pump. So, I mean, the treatment, what you can do to deal with diabetes now is so much better than it was just when he first diagnosed 6 years ago. Yeah. Type 2 diabetes can be, a lot of times it can be reversed. And I had one of my favorite stories. I don't share her name, but she's one of our employees, and she just took it upon herself. She took on a plan to eat healthier, exercise, and lose that weight. And she said, my goal is to get off this insulin. And she has been successful to do that.
That's
and she's
amazing.
lost, I think, close to 100 pounds. And just she's so much happier. She's so
Wow.
proud of herself. And I'm so proud of her for what she's been able to do. But yeah, you can take steps to potentially, at least if not get off the insulin, you can reduce your
Yes.
your dependence on insulin by eating healthier and exercising.
Yep. And as we get older, we don't want to take more medications. We want
Absolutely
to
not.
reduce those. Yeah.
That's absolutely not.
Yep. Absolutely. So, okay, New Year's resolution, New Year. So the most people have financial and health as their New Year's resolutions. What kind of realistic health goals should people consider, especially when we're talking about preventive care?
Sure. Well, I think one of the things is to exercise. And you can start by well, what is exercise? Well, that's one of the reasons why we started Fit City Tyler, is to try to make our community a fit city, one step, one bite, one health conscious decision at a time. So what works for me may not work for you, Michelle, but and vice versa. But one thing that people can easily do is take a walk, and it doesn't take a 10 or 15-minute walk. And
Yes.
maybe if you haven't really done much exercise, maybe a 5-minute walk. Start
Do
doing
something.
Don't just sit there. Start doing something to take control of your health.
Yeah.
It could be a 5-minute walk. It could be a 10-minute walk. It could be watch what you eat more. Eat more fruits and vegetables. Reduce your sugar intake. Sugar is love sugar. I'm as guilty as the other person. I shouldn't say guilty. I love a cookie. I love that ice cream. But it's all in moderation.
Right.
So watch what you're eating. And I know myself, when I'm not eating properly, I don't feel as good. When I've had that salad maybe for lunch, I feel a little better about life.
Yep.
But that's,
You don't hate yourself.
So healthy eating, fruits and vegetables, and some exercise. So do that.
Basics.
Basics. And don't say,
Yes.
I'm going to start going to the gym and I'm going to work out for an hour with all these weights
Right.
and all that, because set yourself up for success. So
Yes.
start by, set healthy goals of, healthy eating, healthy exercise, and, start doing that. And then that should move into, I'm going to lose some weight, maybe 5 pounds. Let's work on 5 pounds.
Yep.
So
Baby steps.
baby steps.
And the basics. So, okay, so if a business or individual wants to get a hold of you guys, what's the best way to do that?
Best way to do that, go to our website, mynethealth.org.
Easy.
Go to mynethealth.org or call us. Our main number, 903-535-0030. Go through the phone tree and we can set you up with all kind of, you can go through and find out which area impacts you.
Awesome. All right. Thank you, George, for joining us. Thank you for joining us.
Thank you.
And we will see you guys next week on the Better Business Beat. My name is Mechele Mills.